Okay, so welcome to the Post-Traumatic Enlightenment Summit, an interview series to help you move past trauma, learn to redefine yourself to build an inspiring life. I'm your host, Jennifer Cunningham. One of the ideas behind this series is to highlight a broad array of programs, courses, books, podcasts, and people that will help you or someone you love who has experienced trauma to move on, grow, and potentially light a fire under themselves to create a more abundant and happy life. Our guest today is Dr. Leslie Korn, a Harvard Medical School trained traumatologist specializing in mental health nutrition and integrative approaches to treating the mind and body. An author of several books, she's going to talk to us today about how nutrition affects mental health. Welcome, Dr. Korn.
Thank you very much. It's great to be here.
Yeah, so I thought we could just start out with you telling us a little bit more about yourself.
I'd be happy to. I began my career when I arrived in the jungle of Mexico at the tender age of 20, and I got sick with absolutely everything there was to get sick with, and I had the good fortune to be where there were no doctors, no roads, no electricity, no phones, and so I had to rely on the local curanderas, the local healers, and thus began my journey in natural medicine for the restoration of health. I spent 10 years there. My work there actually evolved into running a health center with the local healers. And then I returned for my more formal graduate training, and I studied psychotherapy. I trained and practiced for over 35 years as a cranial sacral and polarity therapist. And it was really in the process of doing cranial sacral and polarity therapy that people began to tell me the stories of their traumas. As I touched their body, the stories emerged. And so this catapulted me into the study of trauma, both mind and body treatment of the experience of traumatic stress. So that's a little bit about my journey into this field. And I've been in this field and have worked probably over 30,000 patients in the last 45 years.
Wow.
Mostly people with complex trauma or PTSD.
Great. So we're going to talk today. The breadth of your experience is huge. But we're going to talk today about food. So I've heard you say in some video interviews that you've done that I've watched that mood follows food. So you believe it's possible to use what we eat to help us heal our mental health after trauma. Is that correct?
Absolutely. It's central. And I believe in psychotherapy. I believe in all the things we do for ourselves. But if we don't eat right for ourselves and our needs, for our nervous system, then we are not going to get the results that we can. I would venture to say you could get a 50% improvement in your overall well-being if you're eating right for you, not what the latest fad is. So how does food follow mood? Or mood follows food, either way. When we're in a mood, we grab our food, and so it's really bi-directional.
That's true.
Oftentimes in trauma, we self-medicate with food. Trauma is in many ways an alternating state of mood of being hypervigilant, hyperreactive, but then underreactive and often lethargic and depressed. So we're always balancing out these often out of control states of consciousness. Food is both either stimulating or sedating. And sometimes what happens is that we grab food that's too stimulating, like overdo the coffee, take too much sugar, when we're already in a hyperactive state. That just makes us more hyperactive, more anxious. I like to say, I've got my cup of coffee here. Coffee is a drug. Yeah. It's not a beverage. So use it like that. Coffee, 1 cup, is very good to lift our mood, but much more than that will trigger anxiety. The other very important way that mood follows food is that because of stress, and clearly PTSD and trauma is about stress, our adrenal glands do not metabolize sugar. Both our adrenal glands and our liver don't process sugar as efficiently. And so we're much more vulnerable to having ups and downs from hypoglycemia. And so that's why it's very important not to eat the refined foods, the sugar, the white flour, the white rice, because that spikes our blood sugar and therefore it spikes our mood. And we feel good for an hour, but then we plummet. And then what happens is we don't always make the connection between how what we've eaten has affected our depressed energy, and we think that it's something to do with the trauma per se, when in fact it could be what we've eaten. So one of the most important things to do, if you find that you're in this up and down cycle where your energy is up and down all day and your mood is up and down, think about stabilizing that with protein and good quality fats, and get rid of all the refined carbohydrates. They're a drug that they should just be eliminated from our diet.
So that's interesting. I love that. And, you know, of course, I'm thinking about my own moods and how I can regulate it. It's hard though, because, you know, they say these carbohydrates and some of these refined foods are addictive. And so intellectually, I know that I should be eating a certain way, but what are some specific steps or strategies that I could use to actually make those changes?
In my book, The Good Mood Kitchen, I talk about the principle of substitutions. Think about our brain needing fuel, just like our cars need fuel. Some of us pump 97 octanes, some of us have diesel engines, and our brain and our body is the same. So I think it's very important to be in touch with what we need. But here's the trick that I share with all of my clients. I promise you, if you went on a high protein, high fat diet, now I mean good quality fats. Right. I don't mean canola oil and safflower oil and margarine. I mean real butter. I mean good quality meats and chicken and pork and fish and beans. And if you do that for 1 week and have one salad a day, you're allowed one sweet potato and put all the butter and salt you want on it. I don't care. I guarantee you, you will not be addicted to sugar any longer. That's for 7 days. And then during that time, you'll also notice a change in your mood. You're going to feel much more stable throughout the day. And then after those 7 days, I work with you to define exactly what your diet should be. You know, they call it the SAD diet, right? The standard American diet, for a reason, because all those refined foods and junk foods make us sad.
Yeah, that's true. So I'm just going to diverge a little bit because, you know, was it working in Mexico with some of these healers that you initially got interested in this idea of food and the connection, or what actually led to this?
It's certainly, I certainly began my journey here because there were no pharmaceuticals, thankfully, actually, because they're only to be used in a pinch, really. It's one of the problems I think we face. And so I began my work in the village, learning about the role of foods and herbs. And then from there, I learned what I call indigenous science in the jungle from indigenous people, and then returned to the jungle of Harvard, where I studied the science of nutrition. Right. I'll give you an example that's very relevant to trauma. Many people with trauma and post-traumatic stress have pain. And one of the things that I learned in Mexico in the jungle is the use of the sap from the green papaya. It's called a proteolytic enzyme. And all that means is it digests protein. Now, in biomedical science, we don't get the sap off the green papaya and eat it up in Boston, let's say, but we can buy pills called papain and bromelain. And these are optimized proteolytic enzymes that digest inflammation in the body.
Wow.
And one of the most important things that we experience with trauma is inflammation. And remember, I mentioned about getting off those refined foods, those cause inflammation. And we now know that depression is caused in large part by inflammation. So Yes, eat your green papaya, but just knowing that there are natural enzymes out there that you can take every day, morning and night, on an empty stomach, that will naturally digest inflammation and thereby naturally reduce pain. So that was a little bit about my journey, learning traditional medicine with indigenous people, and then studying what biomedical science told us about those nutritional qualities.
That's great. So it really is that marriage of the ancient knowledge and then the science that you brought together, which is really cool. So, what are some of the myths you talk about in your book and your blog about food that needs, things that need to be busted? People are just thinking old ways about health and how it can affect mood.
Indeed. Let's bust the myth about fat being bad for you, or fat causing weight gain, or fat causing heart disease. Total myth. One of the best foods you can eat are good quality fats. Indeed, one of the first changes you can make in your diet to get very good results that's painless, because my principle of substitutions is let's find a healthy substitution. And I never had a client say to me, oh no, I don't want to eat good European butter instead of margarine. So I work with you to make it work. Virgin olive oil, but get the real good quality fats, because that's what our brain runs on. Just like our car needs its oil change and lube it up, so does our brain. The other myth, I hope this myth has been put to rest, is that eggs are bad for you, or that certain foods create cholesterol and add to cholesterol. Nothing could be further from the truth. And furthermore, there is no evidence that cholesterol is bad for you. Our brain is made up of fat and cholesterol mostly. And we know actually that people with cholesterol over 200 live longer than people with cholesterol under 200. And that all of this epidemic of statin use, which is just a pure ploy to sell lots of pharmaceuticals to lower cholesterol, really makes you vulnerable to anxiety. There's evidence that low statins, statin use to lower cholesterol can create anxiety. There's also evidence suggesting it makes a risk factor for suicidality. And this is why the military is so actively pursuing the use of high-dose fish oil for their vets in recovery from trauma, for example. But we use it for everybody, really, to lubricate the brain, because it helps the chemicals in the brain communicate with each other when there's lots of good fat there. So don't be afraid of fat and eggs.
Okay, all right.
Those are two good myths that we're going to bust.
So, people may listen to this and think, okay, that's great. But what happens if this is, their doctors are saying, no, I want you to still stay on these pharmaceuticals? Are you against pharmaceuticals, or do you think there's a combination that works?
Well, I think it's important for each individual to do what he or she believes in concert with their clinician. We have a growing cadre of physicians who are trained in nutrition, but generally they don't train in nutrition in medical school. And there are certainly plenty of MDs, plenty of prescribers, nurse practitioners who understand and follow what I'm talking about. We've got wonderful naturopaths. And my work really reflects the state of the art in what we call naturopathic medicine or functional medicine. So I'm not out on a limb saying this. There's plenty of scientific research. But I do think it's important to work with your clinician and let them know what it is you would like. To answer your question, I am not a big fan of pharmaceuticals. I think whatever pharmaceuticals can do, nature can do better without the side effects. And so my own clinical practice is devoted to finding alternatives to pharmaceuticals and helping people either get off them if they're not working, because pharmaceuticals don't always work, or they've got side effects. Some people have beliefs that they don't want to take them for philosophical or religious reasons. So I work with each client where they are and what they define they want for themselves. And so I'm open. I do lots of collaboration with doctors, and sometimes together we have people come off their pharmaceuticals, or we can reduce
Right.
and thereby reduce the side effects, which is, I think, one of the big problems.
Mm-hmm.
You know, for example, the use of benzodiazepines recently has been linked to increased risk of dementia. And so we want to be thinking long term.
Mm-hmm.
I think pharmaceuticals have a place in acute treatment
Mm-hmm.
of trauma, but I like to work with some of the longer term nutritional and herbal supports along with food to maintain well-being.
Okay, that makes sense. So, in addition to fats and good quality foods, are there any sort of, superfoods? We certainly hear about these kinds of things. Are there certain foods or things that you recommend that somebody can just start adding to their diet?
Yes, and in the Good Mood Kitchen, I've got a list of my 10 superfoods and recipes. So many superfoods, certainly chocolate, but chocolate without sugar. So I give you lots of recipes of how to make chocolate candy, how to make chocolate cocoa, how to make smoothies, but not with sugar, because the sugar counteracts the effects of the chocolate. We hear so much about coconut. It's such a wonderful fat, very good for the brain and the mind.
Mm-hmm.
How about beets? Have you heard about beets as a superfood?
Yes.
The reason beets are so good is they help you digest fats,
Oh.
and they also decrease depression because they support detoxification in the liver. And so anytime you can grab some beets and also some greens, like the bitter greens, like arugula, those are superfoods as well. Raw butter. I love raw almonds too, and they make a wonderful snack so that you don't ever let yourself get hungry, because when you get hungry, that means your blood sugar is dropping and your mood is dropping, and then you get irritable and cranky. And so those are just a handful of the superfoods that I like. It's important when you're eating nuts and seeds to make sure they're raw as well.
Okay.
And the other thing I really love to share about sea salt, a lot of people are afraid of salt. It's another myth. But sea salt is very good when you're stressed. And so feel free to use sea salt, not the table salt, sea salt. And if you're a carnivore, I've got lots of great recipes where you throw some bones into the crock pot, add some sea salt, and some greens, and in 6 hours, you've got a wonderful bone broth. And the reason bone broth is such a superfood is that it's rich in amino acids, which are the building block of our brain chemicals for good mood and relaxation.
Right. Okay. Those are great. Those are good. Yeah, I have heard of, I've been hearing more and more about beets and beet juice, and so that's good. I had to actually teach myself to like beets because I wanted to like them so badly because I love the color. I knew they were good for me, and I just kept trying it, and now I eat beets.
Oh, that's great. It is true that we often just gravitate towards what we're used to. We need to explore who we are. And particularly in trauma, we can lose touch with ourselves, lose touch with our needs. So I call it culinary pedagogy. It's a way to really take care of ourselves and ask ourselves, what do I like? And like you did, what do I want to eat that I haven't developed a taste for? And it's a very profound way to take care of ourselves.
Yeah. It's from my own personal journey. I went through a cancer diagnosis and treatment and finished last April. And so many people kept saying to me while I was going through treatment and immediately afterwards, oh, so you're eating differently now? And to be honest, I didn't change anything because I couldn't deal with changing that and becoming just this health nut. But now I'm ready. I'm like, okay, I feel like I'm getting myself back on track. And that's kind of what this summit is about. It's about getting back on track. And so sometimes you need to hear these messages more than once, and it'll resonate with you. And so I like, adding some things and these substitutions that you're talking about. It's not about depriving myself. It's substituting for healthier options. So I think that's really great.
Well, first of all, congratulations on that cancer recovery journey. What courage that takes. And I'm so thrilled for you. And you've really hit upon an important point. we're not going to succeed if we beat ourselves up or if we force ourselves or we do what others tell us to do.
Mm-hmm.
We have to really get in touch with ourselves. And that's why I call it the principle of substitutions, that we both slowly relinquish some foods that aren't such good quality as we just improve the quality. And I'll give you an example. I worked with a gentleman, a Vietnam vet, the other day, and he said, I love my hot dogs and sauerkraut. And I said, great. I said, but you know what? I'm going to recommend that you get a very good quality hot dog. I want you to get an organic hot dog because the food coloring and the one that you're eating is messing with your brain neurons.
Yeah.
Instead of getting that sauerkraut off the shelf, let's get you to the farmer's market, get some fresh sauerkraut with those wonderful probiotics that will support your gut and decrease your anxiety. And he was so happy because he thought I was going to tell him to eat, like
kale chips.
Kale chips and kombucha. I said, no, we're not going to succeed if you're going to. This isn't about going to a monastery.
Right. That's good to know. And I'm sure everybody that's watching is thinking, okay, hallelujah. So that's good. So you actually just alluded to this, or you just talked about this idea of gut health. And I've been hearing lots about the gut being the second brain. So what is this connection between the gut and our mental health? And what are some strategies we can use to increase that health?
Well, I'll mention the strategy. So I'll mention that first. One of the best things to improve gut health is probiotics, fermented foods, whether you buy a pill or capsule, or whether you eat your sauerkraut or your kombucha or your freshly made pickles. There's so many wonderful freshly made yogurt or kefir or kimchi at a wonderful Korean restaurant. Because think of our gut, which is the second brain, as our garden. And if when you plant a garden to grow your vegetables, you make sure it's got just the right mix of bacteria and fertilizer. And that's what our gut needs to make the neurotransmitters that help our brain flower with the chemicals it needs. And so our first brain in our cranium talks to our second brain, and our second brain talks back to the first brain. And one of the most important reasons this is essential for people with trauma experiences is that what's called the GABA neurotransmitter, that's the neurotransmitter that helps us relax. Okay. And so that is made in the gut. And that's made because of all the wonderful fertilization of those probiotics. And so if we don't have enough of that, we are going to be more anxious. And I don't care how many benzodiazepines you take, that's just a cover over what the problem is. And so if you can start restoring your gut function, and that means also finding ways to improve your digestion with some digestive enzymes, and you can get off the Tums and get off the proton pump inhibitors, because digestion occurs in a state of relaxation. And so what is trauma but not being relaxed? So understanding this dynamic helps us make better choices for the foods that we eat. So start with fermented foods, but you can also supplement with probiotics.
Okay, great. That's excellent. So you've talked about this in our talk today so far. You mentioned the botanical medicines or supplements. Could you talk a little bit about that? Because I saw a couple of blog posts on your website, and there was a new word, is an adaptogen. Is that a botanical? Like, I was learning a few things. So could you explain that?
I'm so glad. Thank you. An adaptogen is actually a term that came out of the 60s. These refer to herbal medicines that help us adapt to stress. Because the whole approach that I'm talking about is, we can't make the trauma go away.
Right.
That's happened to us. We're coping with it. How do we help our body and mind be more resilient and stronger to cope with it more effectively? And so adaptogens are botanicals that do that. And so, yes, I did write a recent blog post on that. Licorice root, for example, is an adaptogen. It also reduces virus. And we use it, for example, as a topical with herpes zoster after shingles. I've got a wonderful tea recipe that uses licorice root, not the candy, in my book. Ashwagandha is another adaptogen. Another wonderful herb that I love that's unnerving is called kava. Kava is a very powerful anxiolytic. It reduces anxiety. And when I'm working with my clients to come off their benzodiazepines, we will substitute and use kava. And that would be the kind of thing to work with a naturopath or nutritionalist or an herbalist to do. And then one more really wonderful nutrient I like that not too many people know about. It's in a product called De-Stress, and the core product is called Lactium. And you know what, if you've got children, you know after they nurse, they fall right asleep because of the intense casein and the amino acids that calm down the brain, that lead to sleep. Well, the French concentrated this substance and put it into capsule form. And I give it to all of my clients who are feeling stressed. You don't need to have trauma to feel stress and have trouble sleeping. Now, one blog you may have seen is called The Three Sisters of Sleep. And that's a great combination called VHP, valerian, hops, and passion flower. The three of those work together to make each of them more effective. And I give those to my clients who are having trouble falling asleep. So we've got wonderful gifts from the natural world that are full of chemicals. And let's remember, many of our pharmaceuticals were developed from these herbs.
Right.
So we've got lots of resources that are available to us that will not give us the side effects that some of the harsher pharmaceuticals might do.
So how would I go about acquiring some of these botanicals? Do I have to go through a naturopathic doctor, or can I go to a health food store? Are there certain teas or products that I could buy?
It really depends on the pharmaceutical and what your goals are. I'm a big believer when you're on a path to recovery of doing your own research and also working with a guide. That guide might be an expert in nutrition or naturopathy or functional medicine, because sometimes I have clients who come to me, they're using a medicine, and then they say, oh, guess what? I found this and I'm using that too. And I said, oh, wow, you're getting double the amount of medicine. You don't want that.
Right.
Or let's say someone says, oh, I'm on a blood thinner, but I want to use fish oil. It's good for my brain. I said, oh, whoa, Nellie, we need to make sure that it's not going to thin your blood too much.
Right.
So can you get VHP and use that on your own? Of course. Can you drink chamomile tea at night? I've got a great recipe that I love for sleep called a cherry chamomile smoothie. And I think I've got that on my website, because cherries have now been shown to increase melatonin and help sleep. So it's a sleepy time smoothie. So I think a lot of that. But if you're feeling like you've got a little budget for it, I would do your research, because I think all clinicians need to have informed clients and need to be pushed up against with questions. I'm in favor of that. So do your research and then find someone who's really compatible with your way of thinking and what your goals are, just to guide you to make sure you don't have any trouble with some of what you're putting together for your own self-care protocol.
That's great. Thank you. And you on your website, you have some courses, right? Are they online courses that you can take?
Yes, I have some online courses. We're just about to launch an intermediate advanced course, but I've got some courses for the general public and also for clinicians. We are starting soon. We're launching a 24-hour certification program in this topic. I run retreats in Sedona, Arizona.
Nice.
And I've got several books out, particularly one on trauma, as you well know.
Yes. Yeah, that's great. So I'm going to be putting the link to your website. I know there's a lot of free resources, and I've mentioned the blog a few times. So there's some great articles and that kind of thing, so people can find you. Any final words that you wanted to share for our audience, just to take away and improve their mood?
Well, remember, mood follows food, and coffee is a drug. It's not a beverage. So now look at all of the foods you eat and say, is this going to make me feel good, make me feel healthy, or is this going to drag me down? And reach out. Healing is a community effort. So find a pal to get exercise with, make food with, and recover with.
That's great. Thank you so much. And thank you to all of you for watching. I hope you take this information, you help, to move past trauma, learn to redefine yourself, and build a more inspiring life. Thank you.
Thank you.